let me just share this. That's interesting. Let me not share and then reshare. And I was hoping you'd have some action would have happened, but it looks like it didn't. And those of you know that Nicole's the Senior Director of Public Policy at the ARC of the United States. She's been with us before. So I thought it'd be great. I was hoping for a little more action last week, but it looks like, well, I'm going to let you tell us what happened, because Senate has not passed, right? The most recent packages the House has, and just returned, right, last week?
Yes. So, yeah, I was obviously hoping for a lot of different things to have happened. Yes, so both the House and Senate were back as of last week from their summer recess, or their August recess. The Senate did vote on Thursday. So just as a bit of a refresher, I know I've been with you all a few different times, but the House, it bears repeating that the House did act on a very comprehensive fourth COVID relief package, the HEROES Act, in May 15th of 2020. And that bill did include things like dedicated funding for home and community-based services, additional stimulus payments, and fixes that we had been looking for. And that passed in May. The Senate, up until last Thursday, had not taken any action outside of passing some additional fixed legislation. So there had been some additional legislation that had been passed that put additional funds in the PPP, or Paycheck Protection Program, and small fixes, but there had been no other big votes. And so the Senate did vote last Thursday on a we were calling it the skinny bill, because the Senate had released 3 different versions of what they were calling a skinnier version of the HEROES bill, because the HEROES bill was $3 trillion. What they ended up voting on was less than, I think, 500 billion. It did not pass. It got 52 votes. It didn't even get all of the Republican senators. I think I was quoted in the media today as saying that we're demoralized and discouraged, and I think that that's pretty accurate. They caught me on a Friday afternoon, and they caught me pretty honest. But because we're really kind of, frankly, the path forward on a fourth COVID relief bill is looking narrower and narrower. And that's just honestly just big P politics. It's outside of all of our control at this point. There's always a chance. It just has to do with more of the economy. It's really not even healthcare. There's really, obviously, a lot of the funding when it comes to home and community-based services is obviously tied into Medicaid. And for some reason, there's a no real interest in putting in any additional funding into Medicaid, which is very obviously discouraging, no matter how much we've been screaming and yelling. So that's not to say we're not going to continue to push. We obviously will. But I also have to give you an honest picture of what we're hearing. I will say I was on the phone a lot over the weekend with Senate committees that are working on, because also in the background we have the continuing resolution, because unless there is an agreement that in principle that between the House and the Senate, because if there's not an agreement on the CR, the continuing resolution, then we'll have a government shutdown. We also have that out there lingering. And so there is a possibility we'll get some things tied to the CR or the continuing resolution. So I have been in some conversations over the weekend on things like that, but I don't want to kind of be too hopeful about that. I don't think that it's going to be huge things like additional HCBS funding, but it is possible that other things that are important, like EVV, delaying EVV, and other things that we've also been pushing on, we could see attached to that.
That's electronic verification, delaying.
Oh, sorry, yeah, electronic.
Just so people know, yeah, that's been a big concern of people being able to adapt to that, and the costs of that, and right. So,
yeah.
So really, like in the midst of all this, just for people to really appreciate this, we're running out of money because we have so much debt, because we have reduced taxes consistently, and obviously we have programs that need funding, so they haven't been able to cut in our area. They've wanted to cap Medicaid, they've wanted to cap Medicare even, I think. Medicare is probably a third rail because of the aging vote. But what you're telling me, I guess reading between the lines, is this part of a campaign strategy for the president as well in some distorted way? It doesn't make any sense to me as a strategy, but it must be between conversation with the White House and the Senate to not do a major bill, correct? Or
I don't really know, Leo. I think that might be a little bit too
thoughtful.
Yeah, frankly, because I think that we're being told that some senators aren't feeling the pressure, and why that is, I don't know. Particularly Republican senators that aren't feeling the pressure, and to me, that's about the economy. That's obviously not about. It's certainly not because they're not hearing from our folks. We've gotten over 100,000 tracked actions from people that are connected to the ARC all over the country. So it's not because the disability community isn't being loud and proud and being really clear with what we need. And so I always want to be really clear when I'm talking to the network that I'm so proud to be representing in DC, that it's not because you all aren't doing everything that we need. It's just because there's so much of a log jam right now. And so I do think that it might be a little bit of political calculus, sure. Certainly, we do obviously have the election that's out there. And so that is kind of the problem, is that besides the continuing resolution, once they go home on October 2nd, we're not going to see anything until after November 3rd when the election is. And frankly, after that, it's going to be who knows, and it's probably going to be nuts.
Right.
And after that, we could see a lot of stuff, depending on what happens. So,
yeah.
So that is definitely the calculation. I think that they're all playing, yes. And that could be that they turn back to COVID relief in then November.
So I'm going to let people do one or two questions before we go on and let you go and go on and talk about friendship lessons.
Just very,
Yep.
Just very quickly, one thing that struck me is that Rand Paul, I think, was the only Republican who voted against it. And what strikes me is that he's always interested in the deficit. So I'm wondering if that was part of the politics behind it.
Yeah. I think Senator Paul only voted against it because of the cost. So I wish I could say that he voted against it because it didn't include the money we needed for HCBS, but I don't think that was his thinking. But I think it was more about the cost, yeah, and that they hadn't figured out how they were going to pay for it.
Okay.
Any other questions? If not, I can preview one thing, because it's possible that this might happen before the next time I have a chance to talk to the wonderful folks.
We like previews.
Yes. So I'll give you guys some kind of inside information. I can't say too much about it, but one thing that you probably, if you've heard me talk in the 5 years that I've been at the ARC, you've heard me talk about, is the fact that part of why, whether it was in 2017 and we were facing the per capita caps, or the fact that what the Medicaid systems and states are facing because of the stress of the COVID-19 pandemic, part of what makes it so stressful is because of the institutional bias of the Medicaid program. And what that means is that some services like nursing home services and healthcare services are mandatory in the program, and other services like home and community-based services are optional. And that's just because of the way that the federal law was written in the 1960s. So that was a long time ago, and we need to fix that. We need to modernize the law. There's a lot of reasons we need to do that. There are some offices that have been looking at that. What that looks like, why that matters, that's why there's waiting lists. If we didn't have that bias, that institutional bias, there wouldn't be waiting lists. There are offices that are looking at that, and it's very possible that we will see a bill that would address that. It doesn't mean it's going to pass, but it means that it's going to be introduced, and it means we're going to be able to talk about it, and we're going to be able to call our senators and our representatives and tell them to pass something good instead of just defend against something bad. Right. So I just wanted to share that as something that's going to be coming down the pike, as something good to fight for instead of fighting against something bad.
That'd be great. That'd be great. And you talked about that, I feel like half a year ago, or maybe before COVID hit, That there was
Yeah,
some
we've
ones?
been working on it behind the scenes for over a year. Yeah.
Yeah. Okay. Great. Well, fingers crossed, Nicole. It's always a pleasure to have you with us. I'm so glad. I was hoping, when I reached out to you, I was hoping we'd hear. Well, we are. We're getting the inside. This is the inside scoop, folks, because the ARC, as you know, is in DC leads, is a leader in disability advocacy across the board. And when I helped on a survey of other groups, they talked about how the ARC sets the tone and the resources that we have, even though we can always use more, is bigger than any other organization up there. And again, fighting for the big picture, not fighting for more funds for the ARC or fighting for more funds for a line item, specific line item. So thank you for everything you do, Nicole and the team and Julie and everybody, and just really appreciate all you do. Thanks for being
Thanks,
with us
Leo.
today.
Thanks, everybody. Have a good one.
Great. Take care.
Bye-bye.
So that was great. We got to keep up with this stuff. It's never ending, and at some point we'll do a state and federal sort of overview in a few weeks down the road. Well, I'm excited to. Oh, don't forget this. By the way, don't cut us out. So in terms of advocacy, and I'm sure during the week when Maura has her program on Thursday, we'll talk more about the advocacy we're doing. I'm thrilled to talk about both widening the circle and pathways to friendship. Pathways to friendship is a very specific part of widening the circle. Widening the circle's goal is really is focused on friendships as well and social inclusion. And pathways is a subset of that that's working with 24 organizations right now. So it's a partnership, collaboration between Massachusetts DDS and the ARC to advance social inclusion through increasing friendships specifically for people with disabilities and other community members. And when we use the term widening circle, we're really talking about training as well. We're talking, and a ton of trainings have been done over the years, talking about our web pages. We're talking about other inclusion activities, and you may know the toolkits in recreation and school age kids, living in the community, and employment. Employment was the first one that came out. And those, you'll hear more about that as well, but I'm thrilled to introduce Katie Driscoll and Meg Gaydos, who are facilitators, really consultants in the project to other organizations, and as well as trainers. And they consult and train staff at provider agencies as well as others to enhance the social inclusion of people with disabilities. And we see friendship as sort of the highest social inclusion, right? Relationships with family and friends. That's pretty much gets as close as it gets in life. And of course, the lack of inclusion, people not knowing people with disabilities or not thinking about them or not having relationships with them, this leads to inequities in healthcare, education, employment, and other areas of society. And so that's really important. So just one more thing before they take over. Katie's they wear other hats. Katie's the Director of Special Projects and Strategic Initiatives at BAMSI, nonprofit consultation, workshop, and training facilitation. She shares her passion of fostering inclusion and opportunities for valued roles and belonging for people with developmental and physical disabilities. She works to create meaningful connections and more inclusive communities. And Meg Gaydos currently serves as Director of Community Living in VinFin, and she's been there for over 10 years, where she oversees shared living arrangements and individual home supports. And that's, as you know, we've been talking about the bridge to the future and how important those kinds of supports are as we look ahead. She instructs new division staff, folks that are in the developmental division, developmental services division, in building community belonging. And she continues to be a strong advocate for people with disabilities, as she has throughout her 30-year plus career in Illinois, Colorado, and Massachusetts. So I'm going to hand the control. Katie's there. I think I'm handing you the control. I just unmuted you, I think, or we both unmuted you, so I went back to mute it first. And I want to hand you the, I'll be able to do it. Oh, I got to stop screen sharing first. That would help, right?
Yes, then I can
And then-
screen share, hopefully.
Yeah, and then I'm going to give you multiple, okay, there you go. Why don't you go ahead and share now? See what happens. Should be able to share. Maybe I can make you, you know what? I'll just make you a co-host if you're having an issue as well, right? Oh, you got it.
Is it up? Okay,
Cool. Okay. Let me close my chat thing.
okay.
There's Katie and Meg. You want to say hi too quickly?
Hi. Yeah, I'm actually going to start off this morning, and Katie will join in a few minutes. So I wanted to start with an overview of the Widening the Circle Pathways project. And as Leo mentioned, we're a collaborative partner initiative between the ARC of Massachusetts and the Department of Developmental Services. We work closely with our 24 partner agencies throughout the Commonwealth, specifically to advance freely given and meaningful friendships between people with and without disabilities. Our partner in collecting data-based information is CEDAR at the University of Massachusetts Medical School. And while we truly respect and deeply value the relationships people have with their family members and their friends who also receive services, the primary focus of our Pathways work is in really creating relationships between people served and people who are not related, not paid staff, and not also in services. As Pathways facilitators, we meet and consult at least monthly with our partner agencies to increase social inclusion based on individuals' personal interest. Pathways to Friendship trainings include specific strategies used to deepen existing relationships and/or create new relationships when possible. By providing opportunities for meaningful engagement in the community, people with similar interests are likely to connect. Over time, communities embrace the gifts, talents, and capacities of all citizens of all abilities. Individuals are invited to hold valued social roles while making meaningful contributions in their neighborhoods. We know statistically, loneliness and isolation can contribute to harmful health behaviors. In her Slate magazine article, "Loneliness is Deadly," author Judith North says that loneliness is breaking our hearts. It is a serious health risk, and social isolation is associated with many diseases, including type 2 diabetes, heart disease, and an increased mortality rate. People with friends are proven to be healthier, happier, and safer. There should be no doubt of the importance of our work. Prior to the current pandemic situation, we prioritized implementing strategies in which a person became a member of the physical community in which they live. However, when the COVID virus suddenly forced people to stop going to the gym or attending religious services, many relationships that had been built around one physical place in the community were suspended. COVID has taught us that priority really needs to be based upon connections that can lead to more sustainable relationships. Sustainability can occur using available electronic resources or to do so in person using recommended safety measures. Katie is now going to speak to us about resources we hope will be useful to you in connecting people in meaningful relationships.
Thank you, Meg, for sharing an overview of some of the nuts and bolts of the Pathways to Friendship consultation and widening the circle in the work that we do. I also wanted to take this opportunity to share some of our resources that are free and available to everyone. Although through Pathways, we work directly with partner organizations and we look at progress individually in relationship building for participants. The strategies and the tactics we utilize to support connections can be used by anyone. And we really have updated and developed our resources online to be able to share those. So I'm going to try and segue.
Yeah, worst case scenario, if the website doesn't come up to us, all you need to do is stop sharing and then go to your open screen, pick the, you know what I mean, the open screen.
Should work.
It worked great.
Is it transitioning?
No,
Not yet.
I'm looking at the PowerPoint still.
Okay, it transitioned on my screen. So let me see if I can.
I find that's what I need to do. I was wondering if Zoom, by the way, folks listening, Zoom is updating all the time. So I told Katie this weekend, I said, maybe they've done it.
There it is.
Like, good. Okay. Beautiful.
I had that lined up as a backup. So,
Good.
so this is our website, and you can find it right through the ARC of Massachusetts underneath Programs and Services, Pathways to Friendship and Widening the Circle. And really, I just want to briefly highlight some of the tools that are available, But I want everyone to please know, as we learn things and develop tools and offer new presentations, we are constantly updating the website. It's really always kind of in flux. So please explore on your own further. There's so much in here that you could dive into at different times, but please go back and also check in from time to time. And if you're ever looking for a resource, feel free to reach out.
So I want to suggest to people, Katie, what I did on mine. I went from 50% to full window to view your screen, and people can do that at home or in their office. They can go to view options and hit 100% or fit to window. So then they can track even easier with you.
Okay. Sorry, it's not wanting to go down for me for some reason here. The toolbar. Okay, there we go. So as you can see, it talks a little bit about the project overview, but Meg gave a little bit of that history as well as Leo. So I'm going to really more skip to content here. Just during the pandemic time, so since March, we actually formed a Pathways to Friendship Facebook group. So for those of you that are on social media, you can find us online there, and there's also a link right on our website. There's a lot of great opportunities for discussion, and particularly about how people are coping through these times, or, you know, what are some of the silver linings and how are we helping one another through this, whether it's children as they embark in school or through residential programs. So that is also an active way to be able to reach the team and other people that are living and going through some of these same challenges while trying to fight against isolation and make sure that we're all still connected. It's hard for us all to stay connected during these times. So, and we have our toolkits that Leo had briefly highlighted. They're underneath our mantra for the program of sorts, that we say that friendships develop wherever you live, learn, work, and play. And we really kind of look at each environment. So the Making Friends Where You Live toolkit.
You have to turn your...
I have the cursor right over right now, and that really does focus on different types of living environments. So that way you can support people in different types of structures, whether it's at home or if somebody was in a 24-hour supported residential group living environment, shared live-in, that it would be able to give you some different strategies to help support connections in any type of environment. The toolkit, which is Making Friends at School, was designed really for paraprofessionals, teachers, parents, and caregivers. And there's a lot of information on how do you support connections for children in school? What is everyone's role in that? And how can we make sure that, you know, people stay connected and there aren't, you know, separate opportunities for people. We do recognize, however, this was written, I think this was one of the first toolkits, and it really, number 2, it was written before we were in times of pandemic. So certainly things have changed rapidly, and school is going to be quite different for people this year. There are remote learning, there's hybrid models. So we are really actively creating some more guidance to help supplement people get through this time, because isolation and making sure that students are connected with their peers and have that engagement is really critical. So stay tuned. That is something that will be out hopefully soon as an added resource to supplement that toolkit. We have our toolkit on how to make friends at work. And it really takes some of those steps. How do we go from coworker to friend? Or how do we support someone that we know to also develop those relationships? What are the small tactics along the way that we can help that lay that foundation for the potential for friendship to blossom? So that one is focused primarily in the workplace. We have our 4th toolkit, Making Friends in the Community through Recreation, Faith, and Leisure. And that really looks at the capacities to move from belonging and membership to friendship through activities related to one's interests, passions, and culture. So it will really break down in many different environments. And these are also full of not only strategies, but wonderful stories and examples and some powerful resources as well. So they're great to have. And those are all free and downloadable right here, just from an easy link. We have some videos just on kind of the start if you wanted to explore. But we also regularly record our presentations and try to make sure that those are archived as well. So if you have missed something, there are some wonderful presentations right down here. You can see one of our feature webinars that was done just a few months ago by Lisa Drennan, a colleague of ours, on inclusion is not canceled. So that is a great thing to reference during this time. Really for the audience of direct support professionals, people themselves that are at home physically distancing, family members, it gives so many tips and tools on how do we get through this time. And remember, we can still be social while physically distancing. There are many subtopics that you could explore. And again, we are constantly built in. But if you are from a provider agency and you really wanted to look at organizational change and how you could support your social inclusion efforts as an agency, there are some strategies right here. And you could use those as resources to get you started. For those of you that are trainers, there is a trainer's corner, and we've really modified and adapted a lot of our material to make sure that it's user-friendly with great facilitator notes. That way, whether you are perhaps running a staff meeting or a residential program manager, you could take some of those tools and incorporate it into your staff meeting, or if you are a statewide trainer and you wanted to be able to use those. So I know many people have been through our Train the Trainer events, and this is supplemental information that really mirrors our toolkits as well to help people navigate those. There's information on matchmaking. So one of the most sustainable tactics that we've seen, certainly during these times, is when a one-to-one connection is made. And there's information on programs that are specifically designed that way. So if you wanted to gain information from benefits of that type of program, whether it was a formal program within an agency, a standalone program, or just something informal on how could I invite somebody to engage with myself or someone I know and love with a disability. So that again is a great resource, and specifically we've seen during this time how important it is to make that ask and that invitation to engage. There's information on valued social roles, and it explains a little bit more about what we mean, but really when a person has an identified role in contributions that they regularly make within a community. And it can be certainly challenging to do when we are not physically in the community, yet still possible. And we find the more valued roles that someone has, the more able they are connect into community and ultimately build friendship. So that really lays a foundation in that pathway to belonging, membership, and friendship for people. So many great things. You could explore how to get started. And really, I'll let you guys really look at this on your own, but I want you to know there's a lot of information that is available. Our resources are have links to some other experts that we've learned from, like Angela Amato, who has been a great mentor for this project. She has a free toolkit that we have linked as well. That's a wonderful workbook to help to support connections between people with and without disabilities. We also have information for staff, families, yourself on how can you include friendships in the IE process or the ISP process. And some really great tips. That way you can ensure that connections are a meaningful part of those processes. There is information on person-centered planning. I know that our advisor and good friend and board member, Jack Yates, was on Leo Live just a few weeks ago. So if any of you tuned into Jack, he described the process that we find really effective, but you could learn more about how to apply that and how to go through that level of thinking just through this link here. Up the top is a guide to socially distanced activities. And this was created by another Pathways facilitator, a colleague of mine, Phoebe Goodman. And what's unique about this is there's many online resources on how to stay busy and engaged during pandemic times, but this was specifically created to support connections and to maintain that level of engagement with others while physically distancing. Many things are virtual and online, just as we are meeting here today. So we do really emphasize the importance of people having access to technology and really for everybody to stay connected during this time. But it's vital that we stay tuned to that and pay attention and prioritize people that are also most at risk for isolation during this time. That is one lesson learned in this wonderful article drafted by my friend and colleague Meg, and she is going to share some other lessons that we've learned amidst COVID in supporting people to make connections. So I will segue back to the PowerPoint for that. Are we back to the PowerPoint, Meg?
Not quite yet.
Okay, I might have to stop and
Yeah,
reshare.
you stop, share, and reshare. This was great going over the page. Awesome. By the way, I just want to say, as Meg prepares to speak, that Katie and the team, colleagues, took a bunch of time to really curate and revise this whole web page with the tools. It's just exciting me getting to sit through it again and hear what you all did. So great work. And I hope we get the word out about it.
Okay, so now we are at the slideshow, correct?
Yes.
Yes.
Okay, thank you.
Thanks, Katie. So during the COVID-19 pandemic, it's become really crystal clear to nearly everybody that the people who are well connected to others have been able to weather the isolation of this pandemic much better than those who are friendless. While we practice social distancing, we learn the importance of social connectedness. The one-to-one matching efforts are likely more effective at producing the friendships, sustain people through hard times more than mere membership efforts. If the connections made through membership organizations such as church, clubs, or civic organizations do not transcend the time and place of these activities, then connections are likely to fall apart when those groups are forbidden to gather together, such as during the pandemic. When people are connected, whether through one-to-one or membership approaches, early on there should be efforts to both gather and share contact information. Those people who have that information can reach out to others, whether it's by phone, text, emails, video chats, snail mail cards, or letters, to keep the relationship going and maybe even growing. Everyone should have the access to the technology now that helps people connect and the knowledge or support to use it. Even as a shared Netflix video viewing of a film can draw people together to have a shared experience, even something that simple. Another lesson learned is to go old school and encourage people who share a home to do activities together that strengthen their bonds and build skills, like board games, puzzles, card games, karaoke. I think everybody's very familiar with all those activities by now. Many of these activities are ones that can be used in the community to connect with others once it is safe to do so. In our Pathways work, we strongly encourage people also to support people in their local neighborhoods. There likely might be neighbors who are elderly, live alone, are unemployed, or are maybe possibly even nervous about going outside. There might be an opportunity for interdependency. Maybe people served safely could mow neighbors' lawns, plant some hopeful flower bulbs, or even share their bountiful garden vegetables with their neighbor. Such neighborly efforts during tough times will not be forgotten, certainly. And now that we've all really become Zoom experts, we also have found numerous online resources that people can access for activities that keep them busy and occupied while tethered really to home much more than before. As Katie mentioned, we want to look specifically for those resources that connect or reconnect two or more people that aim to increase social connections and build social skills. An extensive and valuable resource while social distancing. I just wanted to put in another plug for Phoebe Goodman's wonderful resource she has on our Pathways webpage. Her resource list is a comprehensive list of activities specifically chosen because engaging in those activities will really increase social skills and possibly result in an increase in social connections. These may be times for physical distancing, but more than ever, this is a time for social connections. As Judith North says, extraordinary circumstances offer extraordinary opportunities. So Katie is gonna continue on.
So I'd like to just share this quote from John Winthrop. We must delight in each other, make others' conditions our own, rejoice together, mourn together, labor and suffer together. Always having before our eyes our commission and community in the work, our community as members of the same body. And this quote is from the speech at the founding of the Commonwealth in 1630. So today in 2020, in that same spirit of the founding of the Commonwealth, we are actually nearly a decade into a deliberate commitment from the ARC of Massachusetts, from the department, by supporting Widening the Circle's efforts, and which has expanded to include Pathways to Friendship, to deliberately create a bigger we and build relationships across all bridges between people with and without disabilities. And now, as we look to the ordinary and support people to connect in the same ways, yet in a very different time, we must keep our eye on the prize. Relationships are what will carry us through this time and help us heal and move through this trauma of today and the joys and challenges of tomorrow. If we are going to support people to have the good things in life, such as friendship, during all times, we must remember that opportunities to support belonging and friendship are still a pressing need. Relationships are critical now, maybe more than ever, and are still possible for everyone.
Wow, excellent. Really, you know, it's amazing. I just want to say again, you know, the work you guys are doing, how important it is, but also it's all our work. And so we have some time for questions and answers. I did put on, I don't know if anybody noticed, I shared, it's Q&A time. But instead of sharing my screen for a second, I'm going to share the Excel thing that both Meg referenced and then Katie referenced earlier, which was going through the site. So it's really easy to use, folks. And there's different, sections to it. So I just want to point that out. But any questions that, let me look in the chat. I know there was questions earlier. One question that I do want to share with you that I answered on the chat, but I think it would be great for you guys to react to it too. Giassi asked about the whole issue of how can other people connect on this project, and why am I having trouble finding the chat? I'll find it in a second. There it is. And, basically I had said as time permits, there could be other kinds of group trainings, obviously probably through Zoom, but the Facebook page allows for interaction, right, Katie and Meg, in terms of people outside of Pathways. And I know Alice had asked about that earlier too, and I shot some information. And that's why you were walking through the tools as well. We wanted more people to get connected and know about it. Go ahead, you guys, answer that.
But actually, if I could just clarify a little bit, because I don't know if I really expressed what I'm really thinking. What I'm wondering is, for instance, you talk about like someone being involved in their community, in their church group, or other civic organizations in their town. Would you as Pathways actually get them connected with people, specific people, or would you just sort of give them the advice on how to do it? I guess I'm wondering if if you have a direct involvement, and for instance, like I live in Bedford, maybe I'm over 60, do you contact the Council on Aging, for instance, and make that link? I mean, that's what I'm wondering about.
No, we don't have the resources to do that, but we would help, like they do with the providers that they're working with, counsel them on strategies, everything from thinking through what is the person really like. Go ahead. Why don't one of you explain how that works?
Sure. So we would work with perhaps someone's support staff or, family that were connected to that person, and then provide some of those strategies and to really help provide those resources and connections. We're not necessarily the actual connectors ourselves, but we try to work with the connectors and kind of open up some of those doors for people. We certainly also have expanded in ways. We've been regionally running community inclusion networks that involve, some provider partners, but also community organizations. So we have had town rec staff join us at those, and we're really trying to bridge that gap and say, how can we work together? People are trying to create more inclusive programs, but sometimes we're not doing it correctly, and sometimes we don't know where to access the right. So it's really, how can we be working from both sides of the bridge together? So we are working constantly to try to bring the community in, and for us to also, reach out. We've done some different types of collaborations and trainings with, faith groups, where we've learned from how can we maybe work on making community companions that way, over that type of connection. So, certainly the models that Leo talked about, it does provide us some outreach, but we certainly do also have some connections with the community and some of those other types of forums as well.
If someone wanted to do that, and this goes to Alice too as well, if someone really wanted to do that, we'd be happy, as time permitted, to meet with people. So let's say they brought a church in. Let's say they brought a group. So like in Southeast, I know you guys brought in a few new groups, and that was part of creating Commonwealth, that our team members ended up becoming facilitators for these groups to expand that effort. But we'd love to do that. Citizen advocacy, Tom Duty's on this show. He's on the advisory board, and we use him as a consultant around matchmaking and other things. And citizen advocacy is actually a project mostly in Western Mass right now, because again, it's resource, right? You have to have the resources to do this and to have the people to do this. So we're hoping through the work of Pathways to teach more direct care support staff or direct support professionals how important this is, so that maybe it can happen at a family support center. Maybe, it surely should happen at a residential program, right? So as a minimum, which is why we're there right now, and working with 24 agencies with specific people in community settings. Meg, do you want to add something to that?
Yeah, I wanted to jump in, Leo, and just add that another great strategy to use, we referred a little bit in our presentation to, is the person-centered planning that we sort of refer to Jack Yates as our expert on that topic, because that really entails getting people together, whoever's important to the person served, and talking through what the person is interested, what possible strategies might be used, what resources could be used. And at the end of the meeting, it really should be different people have different follow-up items on their plate, so that I know it can be a little overwhelming if one person is trying to drive the whole project and to explore everything in Bedford or wherever the community might be. So if everybody who is really involved with the person has a piece of it, then the team can reconvene and sort of get updates and kind of work together to make these kinds of things happen. It works really well if there's, multiple people involved. So I really encourage people to look at the person-centered planning link on our website and hold those kinds of meetings individually with folks. It can be very productive.
That's great, Meg. So I feel like we're entering an area of discussion. We could almost do something on this with you guys, honestly, and get deeper into this if people are interested, because I think it's a great topic. And Alice pointed out in the chat that some people are still dependent on staff for access, and she's correct. And that's why Friends, again, reinforces what we're trying to do here, which we really want to see it grow because people need people. Right now, folks that do have a significant impairment that may need staff assistance to use virtual, you're right. That's why it's important to have a circle around people. And Beth speaks to that, about Meg's point about circles of support model that is there. And for a number of years, PALS was a group that based its strategy off of, I want to say, British Columbia model, where circles of support were developed in the person-centered planning experience as well as afterwards. And people committed to doing certain roles like you were describing, Meg. So thanks for Beth for reminding us of circles of support. And I don't think Jack even uses person-centered plans anymore as the language, right? He talks about design. But these are similar, they all get at the same point. So if people think it's a great idea, if you guys want to vote on this, I never use voting, and even though I'm a citizen and vote in elections, but if people want to vote as participants and hit yes or no to have get in more depth on this topic and ideas and strategies, why don't you vote right now with a yes? And if you don't vote for the yes, I'll know, and then Gene, I just want to add, even though we're on overtime now, Gene, I'm getting a lot of yeses. So we're going to do this again. I wonder if we should just try to do it soon, next week or the week after. I just want to say, Gene Clapper mentioned, I said Gene, geez, I said a last name. I'm trying to avoid that. I see this as a challenge for the most severely impacted nonverbal who are isolated. Previous friends have moved away, gotten married, have children of their own. Yeah, and it's a continual process, Gene. I agree 100%. When I was a young executive director in the South Shore, I remember talking to families. We would talk about this, and they would talk about the people that went to college, that they had friendships in the school years, and how people moved away. And, we should have really, I don't know what I was thinking back then, should have embraced it even more and double timed. So, so we really, everyone, Meg and Katie really believe in this. The team believes in this. We believe it at the Arc. Kerry believes in this. It's really something. And I have to say this project's renewed our commitment to this area. I've learned more, around friendship and just what we really need to do on the ground through this experience than I learned anywhere else in my education and experience. So we'll do this either. Why don't we maybe try to do it in a couple of weeks? I'll check in with Meg and Katie, and we'll get into talking in a wider way about it. All right, talk about what's missing, what's there, what are some strategies. And again, as I mentioned, oh man, is it Nate? Nate's now in charge of citizen advocacy in Western Mass, and we could invite him to share a little bit about what they're doing. If Nate can't be on, I'm sure Tom isn't shy, and he would come on. So do that. Is that Tom?
Yeah. Could I make one suggestion in preparation for that?
Sure.
That each of the people who's a participant here, who would be a participant when you talk about these issues again, have one conversation with a civilian, whether it's your spouse or a neighbor or somebody who you go to church with or whatever, about the idea of relationships between people with and without disabilities. And then you can bring kind of that experience and that person's perspective to the conversation.
Thank you. What a great suggestion. So let's, if we challenge everyone to do it, maybe X% will actually do it. And we'd love to hear your feedback the next time we get together and how people's reactions were. One of the big things Tom talks about, and Katie and Meg, it's all about the ask, right? And asking someone to commit. So thank you, everybody, for being with us. The ARC, really appreciate your participation, your support. We can get through this together. Meg, Katie, thanks, excellent. And everybody, have a great few days. And remember, Kerry's on tomorrow at 11. Kerry, you want to just share who's with you? And then on Thursday, I'm pretty sure we have DLC with us, Disability Law Center. Oh, maybe Kerry had to get off. I should know what she has going on tomorrow. I feel like I have it somewhere. I'm embarrassed, but it is in our notes in my brain.
Oh, hey.
Huh?
Sorry, I had to unmute. So tomorrow I have Kathy Hickey, who's from the Brockton area ARC. She's going to be coming on, and we're going to be talking about welcoming people back into our homes and what kind of questions should we be asking, what kind of screening just so that we can remain safe. And then on Wednesday, we do have a webinar with Hillary Dunn and from the Disability Law Center. And she's going to be talking about a study that's been done over the past couple of years on day habs and looking at community integration. So it'll be really interesting to hear. So hope you can join us.
And there's limited visitation in group settings. Someone just asked me. So anyway, everybody have a great, and by families, not just outside visitors, by the way. I don't think that's open yet at group settings, right, Katie? No outside visitors, right?
Not really. I mean, I think on a very, if it was a close friendship, again, or that type of thing, but it is predominantly families, and things have to be scheduled, and there's visitation protocols still in place. Can be done, but there is a process.
Good. You saved me from misspeaking, so thank you. And everybody have a great few days, and see you on the other side. Take care. Bye-bye.
Thank you so much. Bye-bye.
Bye.
Carrie.
Hi, Jarrett. What's up?
How many the guest speaker tomorrow?
Oh, tomorrow, her name is Kathy Hickey. Okay.
Yes.
All right. Have a good day, Jarrett. Take care. Bye-bye.